Welcome to the lecture on migration and health. In this lecture, I will talk about the relation we can see between migration and health, and I will look at both the origin country and very shortly also at migrants themselves, how they're affected in their health. As a short introduction to myself, I'm Dr. Karlijn Haagsman. I'm an assistant professor of globalization and development at the Faculty of Arts and Social Sciences. I have studied anthropology, cultural anthropology, and development studies, both bachelor and master. And thereafter, I studied a research master in Utrecht, which was on migration. And thereafter, I went to Maastricht University to do my PhD in 2010. I started it and ended 5 years later. I defended, and that was on how the separation of children through migration can affect the well-being of parents. So specifically, I looked at Angolans and Nigerians who migrated to the Netherlands, but their children remained in the country of origin. And the children were underage, so under 21 in our case. And I looked at how that affected their health, their physical health, but also their psychological well-being. That's in short what I did in my PhD, and thereafter and now I'm doing research which focuses on youth and the mobility of youth and how being internationally mobile, so either having lived abroad for a while or going for extended stays abroad, how that affects their well-being. So I have in my research also looked at the relationship between migration and health more in families. So what I will do today is I will talk about the relationship, like I said, between migration and health, and I do this in two different ways. First, I will look at how the migrant is affected by migration or him or herself, and second, I will look how the origin country as a whole is affected by people leaving the country, migrating. I will look at first, the migrant could be affected, of course. Health can lead someone to migrate, and migration can lead to improvements or decline in some of health. And when we look at the origin country, like I said, I will look at how the migration of a migrant will affect the health prospects of others in that country. I will look at remittances, so that's the money that's been sent back by the migrants, whether that can improve someone's health or family members, but also the health facilities as a whole in the country. And second, I will look at something which is called the brain drain, which is when highly skilled migrants leave. It means that the brains will leave the country, and if they are not being, if the gaps that they leave are not being filled, so no new nurses are trained or doctors, that means that they will have less carers that can help them. And so it could lead to potentially a decrease in health facilities and health as a whole. I will discuss each of these. First, before we go into that, I just want to establish what is a migrant, as there are many definitions you could use to define a migrant. First, mostly when we talk about migrants, we talk about international migrants, so people who have come from another country. However, there's also something which is much bigger than international migration, and that's internal migration. And for some countries, it looks like international migration. Think of China or the Russian Federation. You can migrate for vast distances and live in a very different culture within the country, also having different laws. The same goes for the US. So these should not be forgotten in migration studies. As for example, in China, also people from different regions have different rights in certain cities. And second, and this is the most important distinction because these are the most used in research and academia, is first the foreign born and second foreign citizenship, using that as how to define migrants. Foreign born is basically you have been born abroad and therefore you're defined as a migrant. You have to be careful here because it means that even if you're born abroad and have never really lived there, you will be defined here using this definition as a migrant. So my sister, for example, she has been born in the US when we were there for 2 years, and she, according to this definition, will be a migrant, even though I've lived longer abroad than she did, and she grew up mostly in the Netherlands and her parents are Dutch. Second, what is used is foreign citizenship, and foreign citizenship is when someone has a different passport than the passport of the country they're residing in. Again, here you have to be careful because people can get the citizenship, of course, of the country that they're living in, meaning that then they will not be defined as a migrant anymore. And also people can have multiple citizenships. In this presentation, the figures I use, I will use the foreign born because that's mostly been used by the UN, where I get the numbers from. Then there's also the way we talk about migrants. So you have formal use, so these definitions, for example, I gave above, but in popular use in media and in politics, when they talk about migrants, they often have a particular migrant in mind. Either they talk about refugees, or they talk about a certain group that in their eyes stands out. So often when in the right-wing party or extreme right-wing parties talk about migrants, they talk about Muslims, for example, or Moroccans or Turkish, even of the first generation, which will not be defined as a migrant using the definitions above. They have only their grandparents migrated to the northern part of the globe. So yes, you have to be careful how to use it. So I will not go into each of them because it will take too much time, but often in the media we also talk about asylum seekers, refugees, and sometimes also internally displaced peoples. They all have different rights, and they all are defined differently. So refugee is someone who's fleeing from conflict, and asylum seeker is someone who has applied for refugee status in a country and to be able to reside in this country, but is still awaiting the decision whether they can stay or not. So there are different ways in which we define people. Also affects the rights of these migrants and also the opportunities they have in a country. So if they're defined as a migrant, asylum seeker, refugee, etc., will affect the rights they have. And most importantly, what I actually want to show with this slide is that there are many ways to define migrants, but that means that also different people use different measures, and this can have big impacts on how you can view migration and how many people are counted, for example, to be a migrant. I don't have time to go into this specifically, but it's good to keep in mind. Just as a background, so we have a common understanding about migration. Often what is assumed in popular media by people in general is that in the last decades there has been an enormous rise in international migration. And when we look at this graph, and this is showing the total number of international migrants using the foreign-born definition, we see actually indeed there is a rise in international migration. So if you, for example, look at 1990, the number of migrants was estimated at 167.3 million. And in 2019, this already rose to 271.6 million. So that's an enormous increase. You have to, though, be careful with these numbers because this is, of course, dependent on the numbers that the UN can get, which is official numbers. So what is not included here are undocumented migration, which is in some countries very large. But secondly, you have to be careful because you always have to look also relatively. These are the absolute numbers. So if you look at the migration share, so that's the percentage of migrants as of the whole population, we see that actually it has remained quite stable around 3%. So from 1960 to 2019, it has fluctuated a bit, but overall it stayed around 3% of the population. So this is actually quite small if you would compare it to the big numbers before it shows this is quite small. You do have to take into account, though, that even though the part of the share of migrants might be only 3%, many more people are affected with migration. So, for example, if one migrant leaves, he or she might leave a lot of family members behind in the countries of origin. Also, as we will see later, their migration might have some consequences for the country as a whole. But the same goes for the country that they will reside in. They will also be affected by migrants. And finally, this is of course of the whole population of the whole world, and there are some countries which receive many more migrants than others. And finally, just as a note, due to Corona, they expect that migration flows are going to drop. But they expect, though, that the stock of international migrants may not decrease immediately, and that's because migrants can also not return to their origin countries because of travel bans and the disruption of transportation services. So they cannot catch flights to certain areas. So, well, maybe less people go and emigrate, also less people return. Just to show you how it looks like on the world map, this is the international migrant stock in 2019. So this is the amount of migrants that reside in the different countries of the world. The darker the color, the more migrants reside there. And as you can see here, there are some countries which receive considerably more migrants than other countries. So one here is the US. And Europe also receives a lot. So we can see that more than half of all international migrants lived in Europe, which is 82 million, or Northern America, which is 59 million. So it seems that more migrants go to the global north. And by 2000, we see that 3/5 of the world migrants were found in the more developed regions. And also that in 2019, 2/3 of all migrants were only living in 20 countries. And the largest number of international migrants lived in the United States, which is about 90% of the world total, and Germany and Saudi Arabia are second and third. Again, when we look at the stock of migration as a percentage of the total population, we see a difference as compared to the graph before. And we see here that actually Oceania gets relatively most migrants. So that's 21% of total migration. Northern America has 16% of total migrants, and Europe 11%. And some countries in the world, you can see that there's a vast majority, so over 70%, for example, of the population in Bahrain and Saudi Arabia have migrants. So, are migrants, so that's more than the native population. Okay, now on to the relationship between migration and health. Like I said, first we will look at how the health of the migrant him or herself is impacted. Well, migrant well-being is studied predominantly in clinical and social psychology, and that focuses on the migrant's acculturative stress and ill mental health when coming into contact and adapting to a distinct majority culture, as well as in sociology of migration literature that studies the relationship between a migrant's poor integration into the host society and then, as a result, their low subjective well-being. So sociological research on migrant well-being that links low socioeconomic status, which are, for example, unemployment, low income, and low education, and also low social support, so small networks that they have in the new country, and also, by the way, being a migrant woman, leads to all increased health problems they found. So all of these things, which normally, of course, would also lead to more ill health that's been found in general for the population, this is even more so for migrants because they often have higher numbers of unemployment, often lower incomes and lower education than the native population, or also their qualifications are often not recognized, which can lead to extra stress. So they are highly educated, but they have to do low educational jobs because their diplomas are not recognized. Then there's also negative life events and chronic strain that are also associated with health problems. So there is something which is called the socio-psychological stress theory, which is used to explain these associations. And the theory says that certain groups experience a greater degree of particular stressors because they face many life changes and cannot cope with them due to the lack of resources. So, for example, they don't have a social network in the new country they're living in to help them. So, therefore, migrants have a higher chance of experiencing health and psychological problems, which is also due to their experiences with high unemployment, marriages which go south, fragmented social networks, and also often the physical hardships they face. And this is especially when people are undocumented. But there's also the experiences of unfair treatment and discrimination, not speaking the language adequately, and also living in an unfamiliar environment can lead to a sense of disorientation and an increase in their vulnerability. And the longer you stay in a host country, the less of this stress you have and the better your health will become. And these mental health strains can be somatized, which means that these mental health issues can turn into physical health issues over time. So you, for example, see this with refugees, which have gone through a lot of stress and which affects their psychological well-being. They have trauma. This can turn into physical health issues. So far, what I've described seems to suggest that migrants would have more health issues or more health problems, both in their mental well-being and their physical well-being, than the native the However, there's something which scholars described as the healthy migrant effect, and this states that the migrants are healthier actually than a native population, because only if you have good health you are able to migrate. So there is a selection in migration, and it selects only the wealthy migrants, and which has sometimes also been found. However, results are a bit inconclusive. We can see that sometimes indeed migrants have a better health than the native population of a certain country, but in other times it's worse. So it really depends what has been found, and what I would conclude from the literature is that it really depends on the context of migration itself and the reception, and it's a combination of the factors I've already mentioned above. So, for example, you can imagine that forced migration leads to increased health problems, because, as does the experience of a hostile society or being undocumented or having no money. It all depends on the conditions in which you migrate and also are received. Finally, one last relation between migration or migrants and health is that some migrate for their health, and that is they could receive better health if they would migrate. So, in the past, maybe you've heard in the past, like in the 60s, actually, also my aunt I think it would have been the 70s, they would go to Switzerland, for example, the mountains, because the air would be good for if they have lung problems. But you could also see it as a better healthcare in a country as a whole, so better hospitals, and that's why someone who has chronic illness would migrate, or to go to a better climate, which is better for the health. So that's also a relation between migration and health. Okay, this is about the migrant, him or herself, and the health relation. But now I want to look at the health effects that migration has on the origin country. There are two main ways in which this is theorized to have an effect. First, it's the remittances, so the money that people send home, could lead to more development in the country of origin, and therefore it could lead to reducing poverty and improving the health of the population and health facilities of the population. On the other hand, we have what's called the brain drain, which means that highly educated people will migrate out of a country, leaving the country deprived of its highly educated population. And in terms of health, it refers to doctors, nurses, and other healthcare workers moving to mostly the global north, because they're needed there and can get much more pay than they could back home, and have much better facilities than they have at home. So these migrate out, and because they are not replaced by a new workforce, it means that there is a shortage of healthcare workers. I will go into each of these and show you what has been found. Well, first we have what I already defined before, but they are called financial remittances. So simply said, that's the money that flows from the migrant to the home country. So the money that migrants send home. However, it's important to note that it's not only money sent to relatives. So sometimes migrants come together and donate money to a community or a hospital. So that's also seen as remittances. So migrants also have this collective way of sending money. It's also not always money that flows to the country of origin. It can also flow to other family members living in different parts of the world, which have also migrated. And also importantly, it can also be what's called a reverse remittance. So often when migrants migrate, at first they have to settle in the country. They have not found a job yet. They often have to be helped with by their relatives who send them some money to be able to find a job, to find housing, etc. And migration is a very costly endeavor, so it costs a lot of money. The migration itself, but also the settlement at first. So this is therefore we have also reverse remittances. If we look at remittances to low and middle income countries, so that's what we mostly will look at here, and also how migration affects the health in mostly the global south, is a big source of external funding. We can see that in 2019, $550 billion was sent by migrants back home, and these are only the formal streams of money that have been sent, so those that banks can record. But there's also many people who seriously and literally take suitcases full of money back home, which are not counted, so the number is way higher. And if you can which is, well, 8% of the world population receives money from other people. As I said before, only 3% of migrants, but more people are affected by it, and this you can see here. So what also has been found is that these remittances are very important. Adams and Page have found that a 10% increase in per capita remittances can lead to a 3.5% decline in the share of people living in poverty. So it can have a huge impact on the development of a country and reduce poverty. And this similarly, if it not were for remittances, the share of the poor in the population would have been 10% points higher in Bangladesh and 11 percentage points higher in Uganda. What you can see here in this graph is that shows the amount of remittances in comparison to foreign direct investment and to official development aid, which is the dark green dotted line, and foreign direct investment is the blue dotted line. You can see that it's a very stable source of income and a key source of funds for a lot of developing countries. You can see that actually in 2019 there were more remittances than there was foreign direct investment, and way more remittances than there was official development aid. In the last few years, it was more than 3 times the size of official development aid. So basically what you can see here is a very important source of income for some countries, and therefore a very great potential for developing a country, and also as a result improve health in origin countries. And finally what you can see is that it's very stable, because when there was the big recession in 2008, you can see a lot of the things drop. So foreign direct investment drops, 2008, you can also see that the portfolio debt and equity flows drop, but what doesn't drop, or drop actually only slightly, is remittances. So it's also a very stable source of income. However, as this slide shows, we should not be too celebratory when it comes to the power of remittances in bringing development, and hence maybe affecting the health. Because here we can see that remittances flow mainly to the middle income countries, but the countries that would need it the most, namely the low income countries, receive only a very small share of remittances. So yes, it does bring development, it does bring a lot of resources, but not for the countries that need it the most. And you can see that here the inflow of remittances per country, and you see that particularly some countries receive a lot of remittances, for example Mexico, India, China, but the countries that are the poorest So, for example, Botswana, Angola, and Guinea receive very little. And if you look at this, and this is per region, we see that sub-Saharan African countries, which have some of the poorest countries in the world, actually only receive about 6% of the remittance flows worldwide, which is 9% of the total remittances sent to developing countries. The bronze goes to East Asia. And this is basically summarizing what I've said before. This shows the amount of remittances. It's a bit of an old graph from 2007, but it shows the amount of remittances in comparison to official development aid. And what you see here is that in sub-Saharan Africa, that they are much more dependent on official development aid than on remittances. They get much less, which is very different if you look at East Asia and Pacific. So there are, sub-Saharan Africa is still really dependent on, for example, Doctors Without Borders or other NGOs and official development aid. Finally, and this is maybe even more important, and what I didn't mention before, is that migrants are not the poorest of the poor, because you need to acquire quite some resources to be able to migrate, to take a plane, to pay smugglers, etc. So meaning that if migrants send money back, it mostly comes already from middle-income families and goes to middle-income families who had enough resources to pay for migration in the first place. And therefore, the poorest of the poor who need it the most do not receive this money, and therefore it cannot improve their health. Having said that, of course, it could, and it has been also found that remittances can still trickle down. That because money migrants receive can be spent in the country by buying certain things within the country, it can of course lead also to improvements else, and to people also benefiting from the remittances these middle-income families sent home. And there's also, like I said before, there's communal remittances that are sent, so that is migrants together sending money to a hospital. This of course has also big impacts and positive impacts on the country and health. So the second thing I wanted to talk about, and which has been hypothesized a lot, that affects health in origin countries and mostly negatively, is what's called the brain drain, or also the brawn drain. So the brain drain, like I said before, is brains leaving a country and which are then not replaced. So highly skilled labor leaving and then leaving a gap. But you also have brawn, and brawn is muscular strength and power. So brawn drain refers to able-bodied men from rural areas moving abroad, and therefore countries lose their rural workforce, which is also leading to problems in rural areas and agriculture. So the migration of highly skilled nationals can be very problematic, because a lot of states invest in their education of these people. So government money is spent on their education to become a doctor, for example, but then that investment leaves, and if it doesn't come back because they migrate and do not come back, that leads, of course, to their investment going to waste, and actually even bigger problems. So it is important to think about whether the emigration of a highly skilled, if that means that that investment is a loss, or are the vacancies they leave get filled by other people. Then it maybe balances out by the remittances these highly skilled people send out. And if a doctor leaves, does it mean that a community is without a doctor? And which is, of course, has big health impacts. But it could also be that people go abroad for a while, these highly skilled doctors or the nurses go abroad and actually come back after a while, bringing both money but also new skills that they can teach the people in their origin country. So it can also lead to what's called a brain gain, meaning that it helps both the countries who need them, where they immigrate to, who need them in their health care, And when they go back, it helps also the origin country, because they all the skills they've been taught abroad they can use here in their origin country. So brain circulation, that will be when the brains go between countries. Well, this figure shows that worldwide emigration rates of the highly skilled to the OECD. So in other words, it shows the brain drain. And the darker the color, the higher the rate of outmigration of the highly educated. So if we would follow a so-called push-pull model, which means that people are pushed out because of certain things that are happening in their country and pulled to another country because it has a lot of certain benefits to them, then it's actually very logical that there is brain drain. Because the push factors here are often poor salaries, not good working conditions, few career prospects, lack of management and support, safety concerns, etc. And the pull factors will be better pay, better conditions, etc. The opposite of the push factors. And what is very important pull factor is the active recruitment of healthcare professionals. Because the global north has an aging population, it leads to an increased need of chronic care, and we do not have enough healthcare workers to solve this issue. Therefore, they're actively recruited from the global south. This results in half of the developing world's science and technology personnel living in OECD countries, and 1 in every 9 tertiary educated person born in Africa resides in an OECD country. And brain drain is especially acute in small countries and island states in Africa and Latin America and the Caribbean. So just one number, in 2020, close to 90%, yes, you heard me right, 90% of highly skilled persons born in Guyana lived in OECD countries. Similarly, more tertiary educated persons were living outside of Barbados, Haiti, and Trinidad and Tobago than within these countries. And in contrast, most OECD countries, as well as non-OECD countries which have large populations, for example, Brazil, India, China, and Russia, had low emigration rates of the highly skilled, which were about below 3.5%. So for virtually all countries of origin, the emigration rate of the highly skilled exceeds the total emigration rate, reflecting the selectivity of migration by educational attainment. So it's more often the highly skilled that leave a country than the lower skilled. What we also find is that brain drain is more pronounced for women than it is for men. And in many countries of origin, the share of tertiary educated women who were living outside of their country of birth was higher than for men. Well, if we would look at the positive implications of highly educated people migrating, we have to think of the remittances they send back. The wage differences in the care sectors of their origin country and the country they often go to work in are quite substantial, and hence the money that they can send back is therefore also quite substantial, which can have a big impact. Second, the new skills that they could learn overseas could flow back to the country of origin when the migrant returns, or by the migrant going back once in a while. Also, the fact that so many highly educated people migrate could lead to an investment in education in the origin country. And this could lead to brain gains because more brains are being produced. So it would be actually an export of labor, which the country could benefit from. And finally, like I said before, brain circulation will be a triple win effect for the host home countries and the migrants themselves, because everyone would learn from the exchange, and also economically a lot is gained by it. So that would mean if people would go abroad for a while and then return and go abroad for return, the skills would and the money would flow in all directions. And here you can see the relation between brain and development. Like I said, remittances are important because they can bring development. And we see here that the more economic development there is, brain drain will decrease. So it is important, if you want to keep brains from leaving, you have to develop your country. Well, of course, there are negative implications, and that's what mostly has been stressed in the literature. First, there are big investment losses, like I said before. A lot of these countries develop a lot in their education, well, like all countries do, and which is highly subsidized. If they do not return, all these investments will be lost. And actually, the investment will be reaped by the high-income countries, which didn't have to pay for the education, but do benefit from it. Secondly, and also very importantly, and often forgotten, is that descending countries are losing a lot in taxes, because those who are in care work, especially doctors, earn mostly a lot of money in these countries. Therefore, also the taxes that they will get from these incomes are higher. But if these people leave, they will also have significant losses in tax revenues. Thirdly, you have something which is called the brain waste. This is when actually healthcare professionals or other highly educated people are employed in high-income countries, but in functions below their level of qualification. And this happens after. And in my research, I also found people with university degrees which were scrubbing toilets, because often their qualifications are unrecognized, they do not speak the right language, and therefore can only be employed in lower jobs on the lower end, which often also still they would earn more money in that than they would be back home in their their high educated job. Fourth, high skilled immigration could widen inequality. And what I mean by that is that, like I said before, remittances are sent often to family members. If the highly skilled migrate, which are already on the higher end, they send money back home, if that would only be sent to their families and they will not spend it on products that are produced in this country, but they would import goods from abroad, it actually only makes the inequality bigger between these people who have migrants within their families and the more poorer population. Which is not beneficial at all. What is also we see is that there's a lot of resentment from the non-migrant population, because these people who got the chance and who have this education and can work in healthcare where they are so much needed, when they leave, well, they get resentment. And finally, what has been found by some or claimed by some is that remittances that these people send do not compensate for the losses in the healthcare sector. So what we see is that there's a chronic worldwide need for some 2.4 million more physicians, nurses, and midwives, and almost 2 million more pharmacists and other paramedical workers. And this is the WHO who stated this. Currently, there are almost 60 million health workers globally, but they are so unevenly distributed across the countries and certain regions. Typically, they're the scarcest where they are the most needed, especially in the poorer countries. And one of the factors here is the brain drain, which is really mainly affecting the healthcare sector in Africa and Asia. We can see that the doctor-to-patient ratio in developed countries is sustained by recruiting these healthcare professionals from the developing regions. And over half of the countries in sub-Saharan Africa do not, however, meet the minimum acceptable physician-to-population ratio of 1 per 5,000 people. So 1 healthcare worker per 5,000 people, which is the WHO Health for All standard. And in some regions, this is even 1 healthcare worker per 25,000 people, which is, of course, they cannot do proper healthcare in that context. So if you look at the slide here, you can see, like I said, sub-Saharan Africa has 25% of the world total disease, but only 3% of all healthcare workers. So very unequal. 20% of physicians in OECD countries are foreign-born, signaling a high brain drain. 32 sub-Saharan Africa countries do not meet the doctor-to-patients ratio I just mentioned, so 23 healthcare workers per 10,000 people. And just as an example, in Tanzania, 30% of the healthcare workers leave within 1 year of training, and most affected are the rural areas. And here, like Bagrava-Dokier and Moulin found a reduction in high-level immigration of doctors in sub-Saharan Africa. So if they would not go to work in Global North, it would lead to improvements in child and infant mortality, better vaccination rates, and less respiratory infections. So it would really have a big impact on their on the health. And specifically in the rural areas, they are the most affected. What we can see is that they face the biggest shortage of healthcare workers. For example, just as an example, from the US, only 9% of the registered physicians practice in rural areas, where actually 20% of the population lives. And you can imagine that this is much more, this inequality is much more pronounced actually in developing countries, which you can also see in this graph. So they have thought about solutions because, around the world, and especially the WHO, sees this as a big problem, the brain drain, and it has a big impact on health. So what they have done, the WHO member states have adopted a global code of practice on the International Recruitment of Health Personnel Conference in 2010. And many international organizations and countries have responded to this call and this code, and have, as a result, made significant changes to national policies, according to the WHO, that is. So there was, for example, there are certain recommendations, which is that there should be access to education outside of major cities, clinical rotations in rural areas during the studies, so that people during their studies go for a while to rural areas to practice medicine and learn. That there's also in the curricula, in the curricula of the studying medicine within the origin countries, that there are rural health issues that are being discussed and practiced and learned. And what they have also done in some countries is that they regulate healthcare out-migration. So, for example, in Ghana, you have to stay 1 year after your tertiary education. You have to stay in the origin countries. You have to stay in Ghana, and if you return and stay in the country, you get a subsidy in your education. So more of your education is paid, and then if you would leave. There are certain career development programs that are being developed. And finally, and this is more important, so this is what I've all said, it was all on the origin countries. But in the Global North, there are 37 countries who have also taken steps toward implementing the code and have made certain agreements on healthcare recruitment. Saying that, for example, they would only offer visas for a certain number of years, and then they have to return back home. So they would not kind of steal these healthcare workers from other countries. But the problem is of all of these policies is that it's non-binding, and it does little to address the causes of immigration, which is therefore often ineffective. So, I mean, you cannot ask for every individual person to stay in a country just because they're healthcare workers, and they also want to earn more money, and if they have an opportunity, you can't forbid them to go. So what a lot of people say is that all this doesn't really help, and often actually the Global North is still misusing the amount of healthcare workers they still want to attract. Is big, and they still need them, so they only abide by these rules sometimes, not always. But what would be best is to just invest in the healthcare sector in the Global South, so that people will not leave, so that the facilities are good where the people can working, they get a good pay, so they would not have reason to leave the country, and that is much more effective. So to bring it all together as a conclusion, what we can say is that it's not a one-off relationship between migration and health. It's really the conditions of migration itself, and the conditions of the origin and host country that matter. So where the migrants go to, but also the origin country if there are enough facilities. So migration is not the sole cause nor the solution to health issues. It's really the context in which it takes place that matters. We cannot put everything on migrants to solve all these issues because, as said before, only 3% of the world population are actually international migrants. And migration alone cannot overcome structural development constraints. So you cannot expect for a migrant to invest a lot in his country or her country if the conditions there are not good, if the money that is in back will not be used in a good manner. So they will not invest in healthcare if the healthcare is not good and the facilities are not there. So you have to have a certain structure in which they can invest. Then yes, then it might have a good impact. So migration, is really you should really look at the broader development processes because it's really related to that and what impact it has. And finally, the policy should allow for circulation. So if people can go back and forth between origin and in country of residence or host country, then it would mean that skills could be brought back, but also if they could come back to live again abroad, it would be much more beneficial to both countries. But now migration is so strict that people migrate and are afraid to leave because they're afraid they cannot go back in. All of what I've just said is also argued by Hein de Haas, who is a Dutch scholar. Finally, these are some useful resources I want to give you where I got a lot of the numbers from and that you can also get information from if you want to work on a project. Thank you for listening to this presentation.